Subscribe to our YouTube channel and don't forget to press the bell icon to get all the latest updates.
On 6 September, hundreds of nurses from Nimhans, India's premier mental health and neurosciences institute, protested outside the main building due to an incident that occurred a few days ago. Let's find out more about this.
Actually, it was on the 30th of August, one of our nursing staff who went for asking leave to the head of the department. She was assaulted by the same head of the department, and she was pushed to the she was pushed by the door, and she had an injury over the forehead, and suddenly she was taken to casualty, and she had a minor head injury and also having some injury over her lips also. So immediately after that she has filed a complaint against her, and after that we had a discussion with our director regarding the same matter to remove the same HOD from the post. That is not HOD, HCNS, or head of the department. But after the discussion, what they told, they will be removing the same head of the department within 3 days of time, and within that time they will conduct an inquiry regarding the same. But after that they didn't. They have conducted an inquiry, but the inquiry was not in favor of the nurses, and what they did was they haven't removed the same HOD from the post of the HCNS, and after that we had waited for 2 days more, but still no decision came in favor of us. And today we had a discussion with the director also. That time also they were not ready to remove the same HCNS from the post, and so most of the staff gathered here in protest of that, because the same HCNS had many of the allegations in the past also against her, like harassment complaints and denial of appointments and unnecessarily targeting the staff like that. And also many of the staff have written a complaint, and a signing campaign was formed against her, which consisted of a majority of the nurses of this institute. Still all these facts are there in the institute. They were not ready to remove the HCNS, and so we conducted a protest. It means peaceful demonstration in front of our Neurocenter building. So after that they called for the meeting, and in meeting they have told that within 7 days they will be conducting an inquiry against the same HCNS, and within these 7 days she will be going on leave, and after that they will release the result about the inquiry.
The institute of a national importance, and it's a mental treating institute, and important is that before we treat any patient we should be mentally unstressed. Here we are getting too much of stress, and we are unable to concentrate on the work, we are unable to concentrate on the family. That is the issue, and we said we want to have a safe unstressed environment in the Department of Nursing. And next is that many seniors have been depromoted, they were having administration were having all the possibilities to keep them in the position, but still because of certain reasons they depromoted. And that is also the second demand, all the SNOs to be positioned properly according to their things. At least they can give it as an in charge one. And next is that education imposed was there, nowhere in India to the nursing side for one cadre of promotion they have kept two additional education requirement apart from the qualification which they have got to the service. So that is also second, why the institute is following a separate unique rule which is nowhere existing in the central government. So that is the second. And third is that we strongly request them to replace the HCNS, because the poor management as well as the mismanagement and the assault issue. So based on all the issues, we clearly said like the HCNS to be replaced and to be replaced properly by a seniority.
While the nurses wait for a response from the police and for a decision from Nimhans, they are certain of one thing. They want the head of the nursing clinic service to be removed from her position and want fairer treatment and a safer workplace without harassment. This is Vaishnavi Suresh and you're watching Mojo Stories.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.